Welcome to the MENA Spine Congress podcast series. It's a real pleasure to have you with us, Doctor. And could you please tell us more about you and your journey?
So it's a pleasure to be here. My name is Dr. Abdul Razzaq, Al-Obaid. I'm a consultant orthopedic and spine surgeon from Kuwait. I graduated from McGill University and I started my career as an orthopedic and spine surgeon. I was the ex-chairman of AO Spine Middle East International. I was also the ex-president of the Pan-Arab Spine Society. I was a board member on the education committee of NAS, North American Spine Society, along with other scientific activities. I have my own research and publications. I am considered one of the main players in spine education in this part of the world, in this region, the Middle East. So it's a pleasure to be here. It's actually one of the successful congresses that I'm glad to participate on, and I'm looking forward for the program, which looks amazing and fascinating.
It's a pleasure having you with us, Doctor. And now that you've attended the MENA Spine Congress, what is your impression and thoughts about the Congress?
So the organization is great. The scientific program is amazing. We have great speakers from all over the world, pioneers in their fields, experts in what they do, and I think they contribute a lot to the education of our regional surgeons. As I said, the workshops, the panel discussion, the quality of the scientific content is really at an international level, with nice lectures, updated, shared experiences across the world, and with our local surgeons in the Middle East.
Interesting. What makes this Congress such a special hub for doctors to share their abstracts?
Now, if you speak about the Middle East region, one of the things that we have seen evolving across the last 10 years, we used to travel to Europe, to North America, and to other countries to gain knowledge and expertise. Nowadays, we have our own platforms in the region. I'm proud to see that we have such scientific activities happening in the region. So education is important, and more important is basically for the residents and the young doctors to present their work and research. And until recently, we don't have an established platform for abstract presentations or research presentations. And now I can see in the region there is a huge effort to focus on this aspect, which is very important. We can always evolve with understanding the requirements of our population by research and by doing our gap analysis with our diseases, pathology that we see, which is unique in our region compared to the other parts of the world. Only research can help you understand your population and how you can improve your treatment methodology based on such research and scientific activities. So a platform like this, where the doctors can have the chance to present their work, get discussion and analyzed by experts from the world, so they can improve and learn more to improve in the future. So I'm really honored to be part of this, and I'm glad to see this is happening in our Middle East region.
As we're seeing today that AI is playing a growing role across several fields, do you think that AI is having a dynamic role affecting the spine surgery nowadays?
Definitely.
Throughout the years.
Exactly. I mean, AI is now touching every part of our life, and definitely it will involve eventually our practice in spine surgery. So definitely there's a major role. Now we can see, we started with using navigation with robotic surgery, analysis of our imaging with proper analysis of specific parameters, angulations, and understanding of our patients, and pre-planning of our surgeries, simulation of certain procedures that you can do before undergoing the surgery itself is an added value for better results for the patient. So definitely AI I would say that would have a major role in the future in spine surgery, but also we have to be cautious because AI at the end of the day should be driven by humans, should be controlled by humans. It's an added feature that can give you better understanding of results and analysis and maybe save time and give you more accuracy. But by the end of the day, it relies mainly on the expertise of the human brain.
Exactly. So we should control it, not
Exactly, not the other way around.
Exactly.
Yeah.
I want you please to tell me one outstanding thing about this Congress.
Well, as I said, so many things. First of all, the content, the lectures, they are updated. The speakers, the quality of the speakers, they come from across the world. I mean, there are speakers who are experts and whatever they do in their field. We read their textbooks, their publications. They are here with you. They give you the lectures. You have the chance to discuss, share the knowledge with them, ask them questions, and get to know them. I think this is a very great opportunity. It adds value to the region and to the local doctors.
Looking ahead to next year's edition, what would you like to see or experience?
Well, I think so far the program is great. Honestly, I would focus more on paper presentation, maybe best paper presentation, and maybe in the future I would love to see that there will be one day when we have our own scientific journal that we can publish our results for the region. So maybe I hope next year or this year, would promise the launch of such an international or regional scientific journal that we can all share our knowledge and publish our research and results.
Thank you, Dr. Abdul Razzaq, and it was a pleasure having you with us in the podcast.
Thank you.
Thank you so much.
Thank you very much.